Okay. So we are absolutely delighted to have Dr. Diana Hernandez with us. Welcome. Let's give her a hand.
Hi. Hello, buenas tardes. Diana Hernandez. I'm an assistant professor in sociomedical sciences at the Mailman School of Public Health here at Columbia. Thank you. And today I am going to be presenting on energy insecurity. And for many of you, this term may very well be unfamiliar, but the concept and the experience and the phenomenon itself, I believe, will resonate. So this is kind of an environmentally oriented talk, and so given that in the field of kind of environmental studies and environmental action and justice, there's the whole mantra of thinking global and acting local, I'd like to just start with two New York Times articles. And these are experiences that are not too distant. So the first headline is, "A fatal Bronx blaze was caused by candles." And the first line of the story is, "A fire that killed 3 children in an apartment Friday was caused by candles that were apparently being used after power was cut off over delinquent payments," the authorities said. And in another one, so this one was just before the kind of cold winter that we've had this year, set in October. And then more recently, in January, there was another story in the New York Times with the headline, "For some tenants, only thing heating up is a temper." Thousands of New Yorkers complained of a lack of sufficient heat in their apartments, often a long-time condition. According to the World Health Organization, energy is essential to meet our basic needs in terms of cooking, boiling water, lighting, and heating. It's also a prerequisite for good health. And the thing that I'd like to note here is that they also say this is a reality that has been largely ignored by the world community. And that leads us to some questions, including, what do we call a phenomenon like this where someone's utilities are cut off and then a family, in this case actually, I believe there were 5 children in the family were killed in this particular fire, and that particular household, along with the other people in the building, were displaced for a period of time as a result of this fire. And what are the health and social consequences of this phenomenon? So that leads us to this notion and this concept of energy insecurity. And the only other person that has written about this was Frank Cook and colleagues, that describe energy security as a consistent access to enough of the kinds of energy needed for a healthy and safe life in the geographic area where a household is located. Also the ability to obtain the energy needed to heat or cool a home and operate lighting, refrigeration, and appliances while maintaining expenditures for other necessities, including rent, food, clothing, transportation, childcare, and medical care. They actually conducted a study that was an emergency room based study in Boston, and they defined moderate energy insecurity as a utility shutoff that was threatened in the past year, and severe energy insecurity as being heating the home with a cooking stove, a utility shutoff, or 1 day or more without heating or cooling in the past year. And what they found is that moderately and severely energy insecure homes were more prone to food insecurity, hospitalizations, and poorer health ratings. And for the severe energy insecurity group, they found that there were developmental concerns among the parents. And yet we still don't really know enough about this situation. People throw in David Williams, I love his work, and he mentioned the Medical-Legal Partnership for Children and the kind of checklist of social needs, and heating was there, and yet we still don't really know enough about this particular concern. And so my offer to the scholarly community is a definition of energy insecurity and a conceptualization of it. And so energy insecurity refers to an inability to adequately meet basic household energy needs. It's a multidimensional construct that really describes the interplay between structural conditions of housing, the cost of household energy, and the coping strategies that households improvise with when heating, cooling, and other basic energy uses are insufficient. Energy insecurity is a neglected phenomenon that burdens an estimated 16 million households in the US. And I'll walk you through this particular set of images. So on the top left-hand corner, I don't know if this is working, you'll see the condensation that's formed in an icy window where there are clearly drafts, and I imagine this is not providing sufficient a barrier from the cold elements in this particular home. On the bottom left-hand corner, there's a man who's looking at his temperature at his thermostat and really hyper vigilant about setting it at a temperature and wearing a coat, likely because he's responsible for the payments. And then there's a woman who's just sitting in her home looking a bit frustrated potentially, and as you'll see later on, stress is one of the bigger health consequences of this phenomenon. And then, of course, the utility payments and a bill that's on the bottom right-hand corner. In an editorial commentary that I published in the American Journal of Public Health, I described a trifecta of insecurity, which is we often think about food insecurity and isolation from other forms of hardship, including housing insecurity and energy insecurity, but in fact, they're very much interrelated. But of all of these hardships, energy is often neglected in this kind of broader scheme of insecurities. But we do know in the literature that people are making trade-offs, and these kind of competing expenses lead to risk and disadvantage in health and economic well-being. One thing to consider is that energy costs tend to be comparatively higher for lower income groups, thus reducing their ability to purchase other basic needs such as food as they face the heat or eat dilemma. Speaking of, and this conference in particular has had a significant focus on food and obesity, there are a set of studies that have demonstrated that low-income households are more likely to reduce caloric intake as energy costs and expenditures increase. Likewise, the receipt of kind of the energy equivalent of SNAP, which is LIHEAP, Low-Income Home Energy Assistance Program benefits, protects against food insecurity and lowers the odds of hospitalization in young children among low-income renters. And SNAP has actually been found to cushion the shock of skyrocketing heating bills. And for example, very locally, just this past winter, people experienced at the very least a 22% increase in their household utilities given how cold it's been. And so this winter in particular kind of brings to light just how important this issue really is. And as you'll see in the next set of slides, and when I describe the data and methods, this study is really demonstrating the voice and providing an opportunity for people to have expressed this based on qualitative data. And so Miss Mary is a market rate payer in the Boston area. She's also a grandmother, custodial grandmother of 2. And she explained, she said, if I had to choose between paying my rent, paying my utilities, and feeding my grandchildren, I'd feed my children, and I'd worry about that later. My rent's always paid. If I can't pay my lights and my gas, and those are in the winter months and stuff, I need to feed my grandchildren. I'm sorry, but my grandchildren are gonna eat. So this study was based on my dissertation research. It was conducted in Dorchester, Massachusetts, and it was a 2-year study based on qualitative methods, in-depth interviews, and ethnographic observations of low-income households in the Dorchester area. It was actually linked up with the Medical-Legal Partnership program that Dr. Williams described yesterday. And basically, we were really interested in understanding what is the impact of legal services on mitigating the relationship between poor housing and poor health. And one of the emergent kind of themes that came up is that of all of the various housing problems that we were expecting to see, energy insecurity emerged as a significant issue that had otherwise not been addressed. And so, the conceptualization of this problem. Energy insecurity is premised on hardship. And Carol, a Section 8 mobile voucher recipient and single mother of two, said, well, I try to make sure my bills are paid, but that's a difficult job because everything's so expensive. When you're on a fixed income, what are you gonna do? There's really not much you can do. You can only do your best. And Helen is a low-income homeowner and married mother of four, and she said, we're definitely not making ends meet between the price of food, the gas is killing us, just the normal day expenses. It's nerve-wracking. So, energy insecurity, I argue, is a hidden dimension of disease and disadvantage and is characterized by three kind of distinct elements. The first is the physical element of energy insecurity defined by deficient and inefficient housing structures. There's the economic component, which is about the disproportionate share of household income allocated to utility expenses, and the coping energy insecurity, which is about the coping strategies that are utilized. So I'm actually going to detail each of those components. I'll start with the physical energy insecurity. So according to HUD and the American Housing Survey, lower income households are more likely than their kind of more privileged counterparts to live in housing with heating and electrical problems, have experienced multiple heating equipment breakdowns, an interruption in utility service, inadequate insulation and insufficient heating capacity, and also to report being uncomfortably cold from 24 hours or more in winter. And Dianetta, one of my study participants, said, yeah, this house, there's no insulation in the house. That's why it's cold, and the heating's always gone, so the electrical is outdated, as is the plumbing. And Sarah, a Section 8 recipient, says, my bill is $4,500 something. My heat just keeps escaping. There's no heat. He says this is a 4-bedroom apartment. There's no heat in this bedroom here. If I open this door, you feel like you're standing outside. There's no heat in here, and there's no heat in the kitchen. It's a big, huge, empty house. Sharon, who is a Section 8 recipient and single mother of 3, had her home audited by the local utility company, and the auditor, said to her, or basically she wanted them to come over, and she says, I want Boston Gas to come out here with some of their people so they can look at the boiler for themselves. Because the first man, when I got my energy report, he told me it looked like I was heating the whole of Boston. This is Merle, and Merle is also a mobile housing voucher recipient. And I'll get a little bit later on into why mobile housing vouchers are a bit problematic. But even though that's the way in which housing policy is currently being directed. But Merle says, my apartment was huge, but it was awful too because of the heating system. There was gas bills started, that's where my gas bill started to become so high. The heat would always go out. The furnace or whatever it took to control the heat would fail. The heat would be on and it would shut off and it would be on again. It was never constant, consistent heat. It was cold in our kitchen and a lot of our bedrooms were cold. So that basically was the start of my high gas bill because I had to keep running that senseless heat. And she went on to critique the structure of Section 8 and the landlord's investment or lack thereof in the housing units. She said, the disadvantage of having a Section 8 voucher is that these landlords tend to take advantage. In a lot of Section 8 apartments, they only provide heat and hot water. It's always no utilities. It's not the best apartments. I'm quite sure it's not the best heating systems because like I said, I've lived there. I'm a prime example. So we see basically that the kind of structural deficiencies, this kind of structural energy insecurity is actually leading to high gas bills as already demonstrated by Merle and others. And colleagues of mine at the National Center for Children in Poverty, we recently released a policy brief that was based on data from the American Community Survey in 2011, and we demonstrated that basically among the very poor, so those that are kind of below 50% of the federal poverty line, and just as reference, the federal poverty line in 2011 was $22,350 for a family of four. And the way that we're defining energy insecurity, economic energy insecurity at least, is that it exceeds 10% of the household income. And this is what the Department of Energy uses as their threshold. So 82% of the extremely poor experience economic energy insecurity. 60% of those at 50 to 99% of the federal poverty line experienced it. And 30% of those at 100 to 150% of the federal poverty line experience energy insecurity. So we see that it's very prevalent among the poor. But in looking at the connections between poverty and race ethnicity, we find that African Americans, so the green bar are African Americans, across the economic spectrum are more likely to experience energy insecurity, which we imagine is a reflection of the housing stock available to African Americans that may be kind of more structurally inefficient in terms of energy. One of the other things that we found to be very interesting is an immigrant paradox. So that native-born people were more likely to experience energy insecurity, but Latino and Asian immigrants were the least likely. So we've gotten a paper accepted to the American Sociological Association conference in August that basically is starting to grapple with this yet another paradox, immigrant paradox. What we also found, which was very interesting, is that in the South, so we looked at this by kind of national region, and in the South, they're disproportionately more likely to experience economic energy insecurity, and that renters are also more likely to experience this phenomenon. Roxanne is a mother and grandmother. She actually houses 5 of her family members in her home, so it's a very intergenerational home. And when I went to interview them, she had passed me an N-Star, which is their local equivalent, their utility company, bill of $1,971.52. And this was just for the electricity. And so she says, yeah, I pay them every month. I give them like 50, 60, 80 something, whatever I can give them. So clearly this is not getting to the full cost of the energy expenditures, which means that they have a mounting debt. And that debt trap is something that we don't necessarily know too much about. But there's always the issue when it comes to poverty that people should just work more. But we know that the more people work, the more they're disenfranchised when it comes to access to certain benefits. So Elaine is a low-income homeowner and a mother of 4. She's married, and she says, we're still struggling. I'm not gonna lie. We're behind on the bills and stuff like that and trying to catch up now, but that's why I went back to work. But she says, it's either we're under or we're over. We're over or we're under. It doesn't make any difference. If he doesn't work overtime, we don't make the rent. If he does work the overtime, then we get stuck because he's making too much money, so it doesn't really help. So what do people do to cope with the structural energy insecurity issues as well as the economic energy insecurity issues? Sometimes they're huddled in front of space heaters like this, but other times they're really investing in energy conservation. And Carmencita, who's a low-income homeowner and mother of 2, says, our gas bill, thank God, has gone down because I don't use heat all that much. I mean, our heater goes down to 60, 61, 62 tops all year round, and my gas is budgeted. My electric bill has gone out of whack. I mean, we have a $700 electric bill. Other people leverage their medical vulnerabilities. So in every state, the utilities have different regulations around and policies around shutoff protections, but many have either provisions for those who are medically vulnerable or who are economically vulnerable. In this case, Nancy and many other people describe this as a very common strategy. She's a Section 8 recipient and mother of 3, and she said, the light bill was like $2,000 something, and I needed to get a letter stating that I had a child who was under a year old and that had a little mild asthma or whatever, because that way they can't shut your lights off for no reason at all. People also use stoves, space heaters as heating alternatives. They self-insulated and put up their own kind of weatherization techniques, oftentimes assisted by local community-based organizations that were providing those kinds of services. They moved more frequently. People moved from one home to another because they were trying to escape the utilities issue. And then they were also factoring utilities in their decisions to move. So that means that people were often living in kind of poorer quality housing. But if the utilities were incorporated, at least it was something that they wouldn't have to be burdened by. This was also true for people that lived in public housing and making decisions about whether or not to leave public housing, because in most public housing structures, they provide the utilities. And they also put the bills in other people's names, which is a problem that I won't even get into, but it provides these kind of involuntary debt traps for children often. But what are you going to do? So what are the health and social consequences? I'll just go over a few, but stress was the most obvious one. Mariah, market ratepayer, says, the only thing I worry about is just the bills. That's it. I get stressed out with the bills a lot. It's like, gotta take everything kind of a day at a time. And Deidre says, I asked her, like, how does it make you feel that you're dealing with all of these utilities issues? And she says, stress. It adds stress. It's silly sometimes, but I think, like, geez, my lights are gonna shut off, even though I know they won't. But even if I'm behind a few days, a week, I worry. And then in terms of the kind of social consequences of this, one of the things that I thought was particularly interesting is the question of family disruption, so the disruption of kind of normal family life as a result of utilities. And Sylvia says that things kind of started to spiral downward for her when she was depressed. And she says, things got messed up. And she says, then my bills just started raising up. And like I said, I went to the doctors because they turned it off. Matter of fact, they had turned off my light, my gas. So I sent my kids to their aunt's house because I didn't want them, you can't cook or give them a bath or nothing. I didn't want them here. And Tanika, a public housing resident, says, one day I didn't have no money to pay my bill and they were going to turn off my lights. When you turn off your lights, people look at that, and then one thing leads to another when it comes to that. And I don't want nobody coming in here, take my children from me because I don't have my lights on. My kids ain't used to living with nobody. So as a result of this kind of research that I did before, I've now gone on to do a few research projects that are inspired by the energy and security framework that's been developed. The first is to study the impact of energy efficiency interventions on low-income households that have benefited from the Weatherization Assistance Program. And this particular project was funded by the provost grant here at Columbia University. It's a pilot study that I intend to scale up into an R01. But basically, this is assessing the impact of energy efficiency upgrades, such as changing light bulbs, changing heating systems, changing windows, And it involves in-depth interviews with 20 households and surveys with renters and homeowners. It also has a landlord component in which I've incorporated in-depth interviews with landlords to better understand the process of going through the financing and also the kind of renovations to their properties. And my community partner on this is the Association for Energy Affordability in the Bronx. And then I've also engaged in clean heat, in the assessment and evaluation of clean heat policies. So New York City has a really progressive set of laws around reducing the emissions caused by residual oil, number 6 fuel in particular. So they're phasing out the number 6 fuel. And this has provided kind of a really opportune time to look at heat issues in homes, in multifamily dwellings in New York City. So I recently got an R21 to look at this, but before that I had gotten a pilot grant from the Center for Environmental Health in Northern Manhattan to look at 30 buildings in Northern Manhattan that are burning number 6 fuel, and we're looking at them this year, and we'll follow up next year to see whether or not there are any major differences in the air quality, both indoor and outdoor air quality, and also we're looking at temperature and humidity. Many of you who may live in multifamily buildings in New York City know that there's a phenomenon of overheating, and that has kind of particular implications for our community, and my community partner on this is We Act. So I can't provide data on those studies right now, but certainly be on the lookout because we will be publishing voraciously. So I'd like to kind of draw my talk to a close, thinking about policy and what can be done. I'm a sociologist by training, and as a sociologist, we're really good at noting problems, but I am happy for the transition to public health because it really allows for the, at least the offer of solutions and policy solutions in particular. So Merle, that same woman that was talking about sentinel seed, and she was also talking about she critiqued Section 8 housing or subsidized housing. She says, a lot of money should go into these agencies for people like myself who have a high gas bill, or people who, have high electric bills. And so, in keeping with her recommendation, one of the things to do may be to expand LIHEAP benefits while we understand that it's critical that people have more access to these kinds of services that provide cushions and provide safety nets against the consequences of poverty. LIHEAP and Weatherization Assistance Program, outside of some kind of spurts of funding that came through the stimulus package, have gone down year after year. The funding has been cut. But we should also implement energy efficiency standards in subsidized housing and other kind of multifamily dwellings, and then also create comprehensive energy, housing, and health policies, since they're all interrelated. So this is kind of getting a little bit into LIHEAP. I've written papers about this, and I can direct you to them. But what I really want to direct you to is that our community often is equipped with their own solutions to problems, and I just want to highlight this particular policy brief that was written by Mothers on the Move and some researchers at CUNY called South Bronx Residents Solution on Greening Our Hood, which is about retrofitting, creating deep retrofits in the energy infrastructure and public housing to deal with the kind of housing quality issues, to deal with health issues, and to deal with workforce development issues by employing and training public housing residents to be able to do this. And with that, I will conclude with acknowledgments for a fabulous team that has been really instrumental in helping me collect data, and my collaborators and other special contributors, of course, funding sources. And I also want to acknowledge Bob Full because he's been an amazing mentor and super supportive of all of the outlandish ideas that I pop into his office with, including public health entrepreneurship, which we've co-written a paper on. These are a few references for papers that I've written on energy insecurity. And with that, I'd like to say thank you.
Can you define that term since you mentioned it? Economic entrepreneurship.
Oh, public health entrepreneurship? It's basically social entrepreneurship, but with kind of a public health angle. So anything, I mean, I'm mostly interested in entrepreneurial ventures that are really getting at the upstream determinants of health. I am a social entrepreneur. I invest in real estate and have rehabbed several brownstones in the South Bronx for multiple reasons. First, because I'm a South Bronx native, and I moved back to the South Bronx for political purposes. And that is, you know, I mean, in many ways, that was the kind of impetus for thinking about how other people might be able to combat these like very complicated and complex social problems by engaging in market solutions rather than just expecting, you know, like depending on grants and other things.
Thank you and congratulations.
Thank you. Am I?
Okay, so I'm going to make some remarks.
Just give me 1 second.
Because one of the presenters has to access a video that's going to be shown online, and we'll get the PowerPoints going. Who's going to help get the access to the internet? All right. So toward the end of coping with this present challenge, I'd like to read some remarks about our next speaker as a time filler, and so Joe can have the camera on me and not on the football huddle occurring so that they can access this particular video. So toward the end of filling time, let's just remind you that this particular session is focusing on could your house be making you sick, issues involving the environment. And toward that end, we're going to go from the very compelling topic of energy insufficiency to yet another environmental conversation. And that involves the manner in which we are honored to have Dr. Rhoda Zione Alale here today. And Dr. Alale is an environmental nurse, health physicist, principal investigator, president, and CEO of the MiChi Health EpiCenter in Cincinnati, Ohio. She began her nursing career in 1978 at Grady Memorial Hospital in Atlanta and has worked both domestically in 21 cities and internationally in Canada, Kenya, Mexico, and Saudi Arabia. Dr. Alale served as a member of the clinical nursing faculty at Howard University and at the National Institutes of Health in Washington, D.C. She has been acknowledged for her work in publications such as the Wall Street Journal, has made television appearances, and was listed among the 100 most extraordinary nurses in Washington, D.C. for her services to the White House and Congress. As a mother responding to a mysterious illness impacting her son, Dr. Alale had veritable moments of genius. I wrote that. Culminating in a revolutionary invention as confirmation. She was the 2011 INPEX International Gold Medal winner for environmental innovations within a 44-nation competition, showcasing her original engineering of a nanotechnology for ensuring safety from electromagnetic radiation exposure, while supporting sustained energy balance in the body. At the MiChi Health EpiCenter, Dr. Alale directs a team of environmental engineers and research with the goal of reducing indoor toxins in environments as varied as barns, homes, hospitals, offices, and schools through the use of her pioneering nanotechnologies. Dr. Rhoda Zione Alale is a distinguished alumni of the research group on disparities in health within CHEUSE. She will share her presentation time with part of her team contributing to the work of her center. As well as a treasured colleague from Ohio, Dr. Alale will speak on environmental health, indoor toxins, and the health disparities, a medical-ecological eco-engineering and patient care model for reducing illness by decreasing indoor toxins. Let's welcome Dr. Alale.
Thank you, Dr. Wallace, for that introduction. And as you always do, you put yourself in it. And so I want to thank you for being take this time to thank you for being such a mentor to me and such an inspiration. You are indeed and in fact the baddest woman I know that writes a book in 4 hours. While my assistant, Heather Jo Johns, who is my niece, I share her with Joe Johns of CNN, who is her uncle. She's just organizing some nanotechnology on the table for me because this is going to be kind of a show and tell. My contribution to the world as a registered nurse of 36 years is to give a model for action. We can no longer continue to spend hours and hours and years and into the study of environment and yet have no interventions. Right now, what's happening in the world of medicine is we have determined that our environment is creating the illnesses that we're suffering from. In fact, Columbia University has really become the flagship. It is now the apex of research in public health. It was the Graduate School of Public Health here that announced to the world almost 15 years ago that it is a toxic environment and our diet that is creating 95% of the cancers we are suffering. The issue has become, what are we doing about the environment? After being a nurse for almost 30 years, my husband died in Washington, D.C. I was on the faculty of nursing education at Howard University in Washington and a clinical faculty at the National Institute of Health. I came home to Ohio because my husband did not want me to raise our sons in Washington, D.C. I brought this house, $255,000. I had no idea Ohio was the apex of uranium, off-gassing as radon. It is highly radioactive. And I was totally blown away that the New York Times was more concerned about what was happening in Ohio than the newspaper publications in Ohio. It was the New York Times that wrote 22 years ago, Ohio is a mini Hiroshima. Furthermore, they subtitled that the mini Hiroshima is near Cincinnati. So I was really astounded when the American Red Cross came out and said, Cincinnati has more cancer per population than any other major city in the United States. And in this house, I developed breast cancer. In this house, my children were exchange students in Penang, Malaysia, and so they weren't even in the house. My husband died. We relocated back from Washington, D.C. to Wilmington, Ohio, which is a northern suburb of Cincinnati. I brought this house from the school board president, and within the first week of living in this house, I started getting sick, just feeling sick and weak and listless and lifeless. And my legs would hurt in the morning. I'd be sleeping in bed, my arms would just fall asleep. It was like they had no circulation. They was in so much pain, I had to hang them off the bed and shake them in the middle of the night. What happened to me, my son came home to this house, a 7-foot happy-go-lucky guy, came in there and turned into a raving maniac, disrespectful, belligerent, and raging. And I'm like, I know your father has died, but this behavior is totally unacceptable. And we went to counseling. The counselor said, let us get an evaluation of his brain. Something's going on here. He's losing too much energy and he's sustained in a manic state of aggression and anger. went to the doctor. They used an instrument on him called a PSC, a psychosomatic energetic machine that evaluates the energy of brain waves. And it was developed by a German scientist so that you could see energy waves, the potential, and measure the potential of energy waves in the brain. The theta, the delta, the alpha, and the beta waves. And so here they took a reading of my son's theta wave, and the doctor came out looking like he saw a ghost. Doc, your son has lost 60% of his brain theta wave. I'm like, from what? That led me to a conference in Canada where a doctor walked up to me the second day of the conference and said, do you have ants in your house? Ants? I said, they've moved in carrying me around. I'm about ready to charge them rent. And then she said, ants only infest houses that are too toxic for humans to live in. I'm like, are you kidding me? She said, run and get you an engineer to check your house because it could be a life or death situation, and unplug everything electrical. When those engineers came, they took this meter from the military. You put a meter up here for me? Oh, you have it with you. Okay, excuse me. I just need the stencil. They took this meter from the military that you see on this presentation. They stuck this meter that was developed by a nuclear engineer from the Army in my sockets. They measured the radiation from the basement to the crown to the top floor of my house, and they said, we do not know how you are alive. Electrical convergence in your house should not be higher than 50. Everybody say 50. 50. Say it again, 50. And the radiation convergence in my house, as you can see, was 1,032. At 1,032, that is enough to give you cancer. Because what we absolutely know about electricity now is that electricity creates reverse polarity in the body, so you become imbalanced. And let me speak that more plainly. When you have sustained electrical current, it decreases oxygen absorption in the body. That's why electricity has always been classified as a Class B carcinogen. It's always been classified as non-ionizing radiation. It makes your blood thick. It creates blood clots. It causes all kinds of dynamics to happen. And this is what blows me away, that the OSHA regulations, the OSHA department, the Department of Occupational Safety and Health Administration, has now issued a guideline on non-ionizing radiation and made a demand for employers to give you protective gear if you're working with anything electrical. Because when you touch something electrical, it's the electricity from that current, from that circuit, binds with your electrical current, pulling your electricity from your body into it. And it will change the molecular flow of electricity at your cellular level. That is why the National Institute of Health is saying the probable cause for autism is high electrical currents in the house. You see at the top photo, this photo, you see that up here, you see 1,332, that's Graham-Stetzer units. I don't blame the nuclear engineer. He said, listen, if I'm going to be beat up for telling people electricity will kill you, I might as well name the current after me or the measuring device after me. 1 Graham-Stetzer unit has the equivalence of 1 hertz. So below 50 is where we need to be, because what we know, at 50 hertz, the body is able to tolerate that zap, that assault, and rebalance and heal itself. But when we go over 50 hertz, you're talking about damaging the DNA. Now, I want to show you what this looks like. I need a volunteer, because if I bring a member of my team up here, people might think, okay, this lady is playing it out. Heather, which way did my Stetzer meter go? If you'll get the Stetzer meter, I want you to take a measurement so we can see what is powering this gentleman. What's powering this mic? This, ladies and gentlemen, is a Stetzer meter from the U.S. Army. Okay. This is a Stetzer meter from the U.S. Army. It was engineered by nuclear engineers, Dave Stetzer, who is now Professor Emeritus of Electrical Engineering at University of California, Berkeley. He is also Professor Emeritus of Electrical Engineering at Michigan State University. it wasn't until we got this device that we really took electricity serious about causing disease, or we began to associate electricity with disease process. And he developed it because his best friend had a heart attack and needed open heart surgery. From the lasers that they used in that surgery, he developed diabetes because the laser burnt the pancreas and created imbalance in the pancreas. And he developed this machine so that doctors and nurses could better control electrical interface or keep electrical radiation low in hospital environments so people could heal and they could rebalance. So here we're going to find out exactly how high is electrical interference on this podium. Heather has also been an intern with me for the last 4 years. She is on the eco-engineering internship, and her team of about 12 students at Wilmington College actually took my curriculum and modulated that curriculum so it would be on a 10th grade level. And we're developing curriculums for 3rd graders on up because the time has changed. What's the number, Heather? 620. 620. And what is safe levels? Under 50. Okay, so let's see what this is doing to this gentleman. Come up here and tell our audience what your name is, sir.
Nixon Arauz.
Go ahead.
Nixon Arauz.
Okay, Nixon. So we're going to show you what's happening at Columbia University. We're going to stand over here. We have a doctor over here affiliated with the Columbia Presbyterian Hospital here.
And the microphone just to make sure.
Okay. And Dr. Omura has developed a way that we can test balance and imbalance using our fingers. Everybody put your thumb in the air and put your ring finger in the air. Now, if you go online and look up Bedort testing, B-D-O-R-T, which stands for bidigital O-ring test, you'll find you can go through all these fingers and see which ones hold strength when you are out of assault, when you're not having anything, no chemical, no radiation assaulting you. So I'm going to have you stand right here in this field. We're going to do a basic test, Bedort testing, which is a test of nerve balance, and we're going to do a muscle test, which in both of these are tests of applied kinetics, applied kinesiology, which is principally the science of physical therapy. So here we go. Muscle test first. Next, we're going to have you stick. Heather, can you come and hold the mic for me, please? We're going to have you extend your arms like a tree, and we're going to find the bony prominence on his wrist. Everybody look at the bony, find the bony prominence on your wrist. And here, 2 fingers, you're going to extend over the bony prominence. You're going to ask your participant to resist. 1, 2, 3, resist. And he has balance without stress. Okay, so now you're going to put your thumb and a ring finger together. Thumb and ring finger together. We're going to see 1, 2, 3, resist, and he has balance without stress. Look what happens when he holds this microphone. Because this microphone is being powered by over 600 gram stretcher units of radiation or over 600 hertz. Now watch this. To the nerve, 1, 2, 3, he loses energy uptake. Because within less than 10 seconds, his electrical system already has bound to this wireless electrical system. To the muscle, 1, 2, 3. He loses complete energy. Now you know why pastors are dropping dead in the pulpits and people are so weak after they use a handheld wireless mic. Isn't that amazing? And so look what else happens. Hold this. I need you to take your left hand. Everybody put 2 fingers in the air. If you want to find out where radiation is in your body, your fingertips are diagnostic instruments. I want you to take your 2 fingers and put them right here on your chest wall. That's the approximate area of the tricuspid valve, which is on the right side of the heart, and it's receiving blood returning back. Look what happened to the muscle wall. Fingers together. 1, 2, 3, go. Look at that, because the radiation went from the mic dead into his heart. Do you think we need to do something about this, ladies and gentlemen? Yes, we do. Because it's not just the electricity in the mic. We've got to be a change agent for the salvation of yourself, your children. This is where autism is coming from. Imagine if he holds electricity and this is what's happening to him. What in the world is happening to him is his head is laying in an electrical field. So let's do something about it. Thank you, Heather. Okay, don't go anywhere. We're going to do something about it. We still need Heather. Thank you, Dr. Wallace. This is my nanotechnology. This is a tube full of a passive device that is lifeless without this harmonic film. You cannot see this, but this has, you can see this, can't you? This has black specks in it that is the same fabrication of this. Now watch this. When I put this in this tube, it turns it on. So Heather is going to hold this. You're going to hold the mic. We're going to just count to 3. Let's go. 1, 2, 3. Muscle out. 1, 2, 3. Resist. Rock solid. No energy loss to the mic and to him. Because this has created a wireless vortex that went out into this auditorium. Oh, I'm grabbing this for the mic. This created a wireless vortex of biobalanced energy that went out into this auditorium. In 3 seconds, this whole auditorium was biobalanced from a passive device that works without power. Isn't that amazing? If I take the harmonic out, hold the mic again, hold this straight up. 1, 2, 3, are you straight? There's no energy to balance him. There is none. So we have created a system by which we can rectify environments by a team of engineers from the military. I just endorsed the fabrication. You've been fabulous. Everybody with me now? Let's move forward. This technology took the gold medal for the United States in a 44-nation competition. Not only do we have it for your home, we have it for your cell phone. We are changing lives, and this technology is how I healed myself of breast cancer. It's how I walk today. I use it as an artificial nerve. Can you put this back on the table for me? I use it as an artificial nerve in my shoe. And so let's move forward. We have one mission, protecting the genetic code. We've already lost 98.5% of our ability as a nation to protect the unborn. That's what autism is all about. Children, babies being absorbed with racism. That's one theoretical framework. Excuse me, babies being born with radiation. I heard, my mind is still going around on that whole racism component. That is deep with that HIV, I'm telling you. Anyway, our babies are being absorbed with radiation. Where are they getting it from? They're getting it from laying in their beds. Their cribs have a spring in it, a metal infrastructure in the structure of the cribs, and a metal frame that the mattress is laying on. If that crib is pushed to the wall, it will become energized by the electrical current, and it turns into a taser gun. The reason why it is so critical, because if we have men and women sleeping in these high levels of radiation, it alters the DNA, it alters the DNA of the unborn child, and we can actually damage children in the loin of their grandfather. Anytime a child has cancer in utero or in the first year of life, that child's genetic structure has been damaged in the loin of their grandfather. And so being concerned about electrical radiation, about chemicals in the environment, about radioactive gases is paramount. So the model we created deals with the medical, ecological, engineering, and patient care model. It has 3 components. It has 3 components because we have to educate people. We have to educate people because we've been made to believe electricity will not hurt you. We didn't even have Parkinson's disease in America until 1887, when electricity came into the workplace. And since we have installed cell phones 25 years ago, we've gone from 1 child in autism in 20,000 to now 2 children in 91 with autism, because we have not attended to what's in our environment. So we have to educate people to know your environment. You have to self-monitor your environment. You need to know the levels in the wall behind the bed. You need to know the levels coming out from all of your electronics and how when you're plugging in TVs, that increases the radiation level even more. Because why? We've turned our houses into giant taser guns. Electricity disassociates the oxygen and makes us weak. It creates all kinds of imbalances in our organs that create diabetes, that create heart disease. I was totally blown away to find out that there are more women with heart disease than all of the combined cancers in women. And so we've got to shift the paradigm in medicine. Medicine is not enough. A pill is not enough to sustain your health and your vitality. We've got to look at doing something to remediate and retrofit your environment so it can stop taking your life. Our houses are killing us. Say that with me. Our house is killing us. Say it with me. Our house is killing us. Tell your neighbor, your house is killing you. And we have got to get our souls stirred because our young pastors are trying to preach and teach and educate and inspire, and they do that holding a mic and drop dead with their last breath at 49 years old. Somebody's soul has got to be moved and stop seeing all these children orphaned in the community because our radiation levels are 1,000, 1,300 to over 2,000. We must make a change. And so this is what blew me away. When I got our colleagues together to study this matter out, when we found out that in medicine, in our international diagnostic codes, we had environmental codes, that we had codes that said the environment will create the disease. I said, are you serious? You mean to tell me we have an ICD-9 code that talks about electrical currents can take your heart out, give you all kinds of rashes and arthritis, contribute to brain to short-term memory loss, dementia and Alzheimer's. We have codes that say that. We have codes that say, CPT codes that say a doctor can write a prescription for the manipulation and the adaptation of your environment. If the electricity is causing the problem, he can write a prescription to have engineers come to your house, remediate the problem, and advocate for insurance companies to pay for it. We've already got Blue Cross Blue Shield to pay for a set of these tubes for a child that was born with seizures, had 15 seizures a day, never walked, never talked, never learned. She sat just like lifeless in a walking apparatus all day. Within 24 hours of having her home remediated, she spoke her first word. By day number 3, her seizures went from 15 a day down to maybe 1 or twice a week. Now she's been 2 years in the environment. She's walking, talking, learning. Had the audacity to send me a video on Monday of her swimming across the swimming pool. We can make a difference. We can make a change. The environment has to become part of the protocol. Environmental remediation has to become part of the protocol of our patient care regimens. So the evaluation component of this model directs evaluation of the environment in addition to evaluation of the patient, the history, and the disease process. And of course, the third component is eradicate this. We know it's a problem. We document, it is well documented in the literature that chemicals and radiation and radioactive gases will impede and impair and take your life. As a result of the Cleveland, Ohio, the city of Cleveland, suing the EPA for $180 million because the city of Cleveland is so toxic that people are leaving it in droves. And the Cleveland Clinic is advocating every day on Capitol Hill to get something done about the chemicals, the gases, and the radiation, and the electromagnetic interference. So as a result, the American Nurses Association and 7 other organizations sued the EPA, and they won. They had to fully disclose chemical conversions across the United States. You can go to this link, and you can find a complete listing of chemical convergence in your neighborhood. Over 128,000 schools were named as toxic schools, 6 schools in America. How many people, just by the show of hands, how many people knew that this information was available? Anybody? This information has been available for 4 years. You can actually find out what chemicals are in your neighborhood just by knowing, going to this link and typing in the name of your school. And this was mind-boggling because when I typed in the name of my school, it was the sickest school in the city of Wilmington, Ohio. It was converging with sulfuric acid, manganese, and hydrochloric acid, which is a chemical cocktail to make you lose your mind. It can put you in a state of manic aggression. And here my son was having a hypersensitivity to the reaction, not only to the electrical radiation, but to the chemicals that were converging, and 2 blocks away from us is the most toxic school in the city. This is the radiation maps. You can go to the EPA and look up the radiation radon maps. You will fully find out, they will fully disclose to you what are the radiation uranium levels that have potential gas toxicity for you. This is the state of Ohio. I live in this general area right here, in the Cincinnati area that borders Kentucky down here. And you can see that's approximately my little county, Clinton County right there. We have had a mass exodus out of our city because we were the home of Airborne Express, which was purchased by DHL. How many people have heard of DHL? It's International Express. DHL spent $40 million plus to move to our little town, stayed 18 months, and spent almost 1.5 times that to get out of town. Now, we all understand the value of $1. What would make a corporation get out of town in 18 months when they've purchased the only private airport in the United States? And so as a result, this very hour, you cannot drink the water because of the levels of contamination of ionized radiation. We cannot drink the water in our city. Everybody on my street has cancer. Our speaker, one of my panel members, was going to come today, and the husband of his secretary dropped dead. There was 9 funerals that went past my laboratory last week. Masses of people are dying, and yet all my family is there. 15 generations of my family. I have nephews battling cancer. There's no way I can leave my family defenseless because I was birthed out of a family where we love one another, we protect one another, and they have so much infrastructure in businesses and so forth that we have had to arm together and fight. Because the good news is we can correct and stop the assault of these chemicals and these radiation levels against us by having the proper infrastructure, the proper mitigation, and proper ventilation in our homes. We've got to air the homes out. We've got to lower the radiation levels so we can live. And that's what I'm fighting for. That's what I'm a change agent for. That's what I came to Columbia University for, because when you come to Columbia, you are birthed to be a change agent, and you are sent forth, and the love and power up in this house will give you enough fuel to make a change. My colleague is going to introduce my U.S.-Canadian initiative. I've been favored in Canada because Canada understands this. Canada already has 4 environmental health clinics. They are already putting together teams of engineers to come out to your house. If you're pregnant, the engineer is coming out with the visiting nurse. They're already being pro-aggressive, and they're using my model. I just trained 7 engineers in how to go out and use these technologies to remediate homes. And the campaign got so good, the farmer up there said, what will it do for the cows? I said, well, you know, I don't know that much about cows, but I tell you what, I know my technology. If you give me the opportunity to run a simulator on your farm, I'll tell you what it'll do for the cow. Honey, I'm limping today because I had the courage to go up in Canada in winter when it was 30 degrees below zero, and it was knee-deep in snow, and I went up on the second largest farm with 1,200 cattle. I saw the largest robot system that milks cows, 50 cows every 12 minutes. The stench in there of urine and manure took us all. It took our breath away, honey. We couldn't sing no Marvin Gaye, no Aretha Franklin, nobody can hold a tune. We locked ourselves up in they have like a cabin that oversees the cows. Everybody ran, hold up, let me in. My eyes is burning, my nose is burning. Lord, we got 50 cows in here milking at a time. I'm telling you, we set a simulator within an hour and a half. This technology not only mitigates and bioharmonizes electrical radiation, but it creates an energy wave that is an air sanitizer. We had diffused at least 90% of that smell. So we could go out and we actually interact with the cows that they was coming off of these robots. Nobody could believe that. That was the first that we learned about it. But within 8 hours, we had those cows so contented, I declare to you, they start saying, grooving. These cows start getting smooth. The milk energy was higher after they came through a bioharmonized robot. The cows were more contented, and so we had to run a simulation for 8 hours. By the time those cows got to the third feeding of the day, they lined up like they was at a Paris fashion fair. Everybody was waiting their turn because they knew they had something to do and something to show. When they went on that robot, honey, they just went on smoothly and backed that thing out and came off smoothly. And the farmer said, are you serious? I've never seen my cows this contented. Put that technology in the barn. You know, I was happy then. Whoop, there it is. Got my check. Just let me get the digits together. Okay. So, to educate, the Environmental Protection Agency has said 6 out of 10 of our homes are toxic. I've already told you about Columbia University. The maps are available, but this is what blew me away. The Center for Disease Control has free education for every doctor and nurse in America because this is a national crisis. Us being so toxic from these chemicals, we have got to enhance the skills of doctors and nurses. We don't have anything that gives us the ability to come in and screen for radiation or go to these databases that are now available for us and see if you have seizures, is there manufacturing with chromium-6 in your neighborhood? I found that people who have seizures are living within 3 miles of a manufacturing of chromium-6, especially when you've been all your life, you're 50 years old, you've built your $500,000 dream home, and now you're home all day, and all of a sudden, within 3 months, you start seizing. Something chemical is in your environment. So we're going to start with the codes. And my colleague, Dr. Smith-Inkes, is going to take us into 3 care models we're now using for seizures and asthma and for people with tremors. I'm telling you, these models are just evolving every day. We talked about the tubes, the tools that we are using, the meters. And we talked about this alpha filter. Heather, if you will put that back in, I want you to take. This is our first line of defense. We take an alpha filter, we put a bioharmonized technology on it, we plug it in. What we're finding is that teenagers love this thing because it looks cute. And they're experimenting with it. And they've taught me so many things about it. We made these technologies to interface. So my cell phone system actually talks to the tube. If you have the tube in the walls and your cell phone in the middle of the room and you want to increase the wave, you take your cell phone, point it to the tube, and you'll make a bio wave. We're going to demonstrate that here. What did we reduce the radiation to? 92. We brought the radiation from 600 down to 92. Now, this system was made by Texas Instruments for spacecraft. It's not even designed for commercial buildings like this. But I will take it to a commercial building and I will plug it in because if I can reduce it, we don't have any larger capacities for buildings yet. But when we put our tubes in the building, we put these capacitors in, it would reduce it down to under 50. My tubes, they decongest the line so these instruments can work building better, and that's how we do it on commercial buildings. In the homes, we don't always have to do it that way. But we reduced it down to 92. How many, where's my guy at I was testing? Come here, I need you. I want to just see if you're able to tolerate 92. Okay. Well, that's good news. Heather said on the other side of the stage is 1,700. So somebody put in some extra filtration. Maybe we ought to stop and just give thanks for that. Here we go. So we're going to have you come over here and just touch this mic. Just put your hand around it. Now let's see if your muscle can tolerate that. 1, 2, 3, go. Give me resistance. 1, 2, 3, resist. And he can tolerate 92. Isn't that amazing? Some people can't tolerate 92. To the fingers. 1, 2, 3. Give me all your strength. 1, 2, 3. He can tolerate 92. This is why you need to know your level of tolerance. Thank you. Sure. I probably got a few more jogging trips for you. So the skills that we have to educate every single person in this country needs to learn Bedort testing. Why do you need to learn it? Because you got your child on a cell phone when the American College of Neurology has said cell phones cause acoustic neuroma or hearing loss. And so when you make the decision to give your child a cell phone, you've got to put these types of questions in front of you. Are you willing to live with a child that has lost their hearing and will never hear their children cry? Are you willing to live with the fact that you're giving a child a cell phone and they're staying on it with their left hand, weakening the heart, so they'll need a pacemaker by 16? We have so many teenagers getting pacemakers now. Are you willing to deal with the fact that while they're texting with both hands on that cell phone, that they're actually stimulating and lowering energy on both sides of the brain? And that's why sometimes they come off of hours of texting and they got these belligerent attitudes and defiant behaviors that makes you just want to take them to the other side of Timbuktu, out there on the other side of Madagascar someplace. We've got to awaken ourselves and create a revolution that empowers people for self-assessment. The one lecture I will never forget Dr. Wallace taught is on the self-observing ego. If you want to make a change in somebody, you've got to empower them to begin to observe their behavior. Behind every model of racism or every theoretical framework of racism is a person who has internalized that they don't deserve to be loved, they don't deserve to be prospered, they don't deserve to be valued, and that thing can be perpetuated. We've got to somehow empower our families to make a difference, make a change, manage, measure, and monitor their environments, and to retrofit it for their health. Because if you have a level that's over 200 and you're laying your head in it, my colleague did a PowerPoint presentation, and her research from the National Institution of Health showed people can get bipolar behavior and sustained manic depression that causes suicide. So when patients are talking about suicide, the first question that we as practitioners can ask is the wall behind your bed over 200? Because it could be. If they have depression, are we asking, what's in your environment? Is there manganese in your environment that could be causing your depression? If they have cancers, are we asking, is there sulfuric acid and hydrochloric acid in your environment? I love Fran Dresser. Fran Dresser has sponsored 2 campaigns for me. She's got a campaign going on called Detox Your House. This is free to everyone. She's got all kinds of cards and activities that you can do with your families and friends and church, civic organizations, and she is making a difference. We can team up and make networks, because this is not new news. This is old news that people are going back and seeing. We've known about these chemicals. We've known about this radiation. And so now what are we doing about it? She got uterine cancer. And when she found out it was from the VOCs and chemicals in her house, it empowered her with fire that passioned her, that gave her a passion so that she could get a program and making a change. She's got a fabulous operation right here in New York, giving away free mammograms and educating people about chemicals in their house. What amazes me with people, that they don't even know, Microsoft has launched a multi-million-dollar campaign. How many of you have seen this label now on Microsoft Office's computers? Anybody seen the health warning label? Well, Microsoft and Compaq got sued. Sony and Nintendo did too. They all have health warning labels now. If you read under the keyboard, it will tell you that this keyboard will create serious disorders. Now, I refute that statement, because if I turned off the power supply to this podium, you can touch everything up here and you will not lose energy. What I refute about it, it's not the keyboard, it's the electrical current. Because you just saw the gentleman touch 90 biometric units of radiation. Did he lose energy? No, he didn't. But when he touched 600, it knocked him all the way out. So the question has to become, and we have to create a paradigm shift so that when you're sitting down at your computer, you absolutely know what is the radiation level you're plugged into. because it takes exactly 10 seconds for radiation to absorb in your chest wall. And if you're a woman, you're filling your breast up with radiation. So here you have adipose tissue in the breast, whose function is to insulate and store toxic waste. And if that breast is in balance, it cannot properly offload toxic waste, and so toxins get trapped. They produce gases that produces abnormal toxic tissue that becomes cancerous. And that's why in some communities we're looking at 9 out of 10 women with breast cancer before the age of 40. We've got to start educating. What are you plugged into? You've got to know, what is that radiation level behind the wall in your bed? Join Microsoft Office. They have a free training CD for you. All you have to do is write them and ask for it. The medical-eco-engineering patient care model for retrofitting workstations can make a difference. I had to retrofit my workstation. Now it becomes an energy station to me. The police came outside of my lab at 4 o'clock in the morning, knocked on the window. Said, "Are you okay in there?" I said, "I'm fine." I said, "What you doing in there?" I said, "Talking to South Africa." I said, "This movement is creating all over the nation." My point is that we can turn our workstations into energy stations that no longer drain us, but yet support our life force so we can live. Thank you, ladies and gentlemen. I just want to show you one more thing. Diet. I found this product in Australia I've been looking for a long time. I want to show you the power. Can you take that harmonic out? I just need you one more time. This is what is so amazing. It's so amazing to me because Columbia University said it's the environment and diet. You have to have high alkali foods in your diet, foods that are high in antioxidants. Because one thing that radiation does, in particular electrical radiation, it drains iodine from the body. When you don't have adequate iodine, you cannot properly uptake trace minerals. And when you don't have trace minerals, you have sustained fatigue. So if you're tired in the morning, when you wake up and you're tired at night, you need to have your doctor and your naturopath evaluate you for antioxidants and trace minerals. I found this product called Energy from Australia. It's natural. It does have a little bit of caffeine in it, but it doesn't have any sugar. This is so amazing to me because you took the plug out, Heather, the alpha? Okay, great. So I want you to hold this microphone again. We know that this microphone takes him out. 1, 2, 3, go. Knocks the muscle right out. But watch what happens. When we take this can of Energy, because it's high in antioxidants like vitamin C. Can you kind of hold these two together? Watch what happens. 1, 2, 3, go. So the power of food that you eat will determine whether or not you keep nutrients in your body or whether you don't. Thank you, Dr. Wallace. Hold that energy drink, because it's only yours. I worked you and took the trace minerals out of you. I said all that to say, when you're going to the grocery store, you need to look at high-powered foods that are high in antioxidants, fresh vegetables and organic vegetables and foods. You need to make sure that you have an intake every day of a high antioxidant food. Because if I give him this can of energy to drink, I will no longer be able to biobalance him. One more thing. Water is supposed to give you energy when you drink it. But because the grounding apparatuses of our house are bound where? To the hot water tank, they have destructured our water so the water doesn't have the full energetics that it's supposed to have. Now watch this. Hold this one. Can you hold these two together? Okay, like this. Hold one hand. Water, hold the mic up for me. Water, this water is supposed to keep him balanced. 1, 2, 3, go. And it does not. So when you're drinking water, if it's come across the scanner at the grocery store, if the water has come across the scanner at the grocery store, it has been irradiated and it has been destructured. So watch this. 1, 2, 3. There's no energy to sustain him. How about if we had a product that just energized the water? Matter of fact, you got a cell phone? Can I have it? This one goes in the cell phone. We turn the cell phone into a really super smart cell phone. Put this nano on the cell phone, stick the water on here, count to 10, everybody, so we can wake up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Put this down, take this water. Now this is 600 biometric units of radiation. 1, 2, 3, go. Rock solid to the muscle, fingers together. 1, 2, 3, go. Rock solid to the nerve. So how about if we energize our food so we are able to sustain our life force because our children are so fatigued. I had an Amish in closing. Thank you, sir. This drink is for you. Wait a minute, I got a nano for you. Got the nano with your cell phone. There you go. I know y'all wish you participated, didn't you? All right. In closing, we've got to look at the life force in our food. We've got to look at the energetics, the chemicals, and the gases in our homes. We can make a difference. We can make a change. This is Columbia University. Everything we need, everybody that's rocking environment is here. And bring us all together so we can have a model that the world can use. As a result of our model, we're already getting prescriptions from the Cleveland Clinic. We're already getting prescriptions from doctors locally. And we can make a difference. We can make a change. I'm ready to pass on to the other presenter. Okay. I'll come back and follow up with my case study after she finishes. Okay. All right. Marty? I'd like to take a few minutes to introduce my colleague who's the first student that I had defending a master's in nursing. And she was a colleague of mine. We've taught at a local college together, taught nursing together. And it's been wonderful to mentor her over the last decade. In her nursing, she is now just a diva, rocking the University of Phoenix. She's on so many committees. She's just helped to institute a physician's assistant program, and I'll let her tell you a little bit more.
Thank you. Thank you. Glad to be here. Hi, my name is Marty. I'm glad to be here today. Thank you for having me. A funny thing happened to me on the way to a new job that I had, teaching for the first time. I met this dynamo here, Rhoda Alale, Dr. Rhoda Alale, and she influenced my direction that I decided to go in my academic studies. Seeing her being so dynamic and so passionate about her environmental health had me do meta-analysis and have her as a mentor for myself in my graduate projects. And finding what she was saying true in the research that is available through the NIH, the WHO, the EPA, CDC, has been astounding, because I considered myself quite literate. I considered myself quite learned and knowing what is going on around me. But finding these articles that are available to everyone, but no one is talking about them. No one is publishing them, thank you. And no one is talking about them. I guess they're not good sound bites for our media that we have today. And what I decided to do for my graduate project is do grassroots interventions. I put together what I found that was already out in there for everyone to know and everyone to see, and started going around to women's groups and to civics groups and talking to them and starting grassroots. When I was going around and talking, at the time, this was just starting to become known. Rhoda was on the absolute cutting edge vision of doing this. One of the medical experts in one of our national TV news agencies was coming on to programs as well, saying, I'm a neurologist and I know that none of this is true. You don't have to worry about your cell phones. In the meantime, we were seeing women who were having increased breast cancer of the right breast. If there's any other nurses out here, you know that historically we've always had left breast cancer first. But when you use your cell phone, it radiates right down through to the right breast. And we were starting to see that. We were starting to see oral cancers that we'd never seen before. Bluetooth, we were starting to see eye cancers because the Bluetooth radiates right into the eye. These things were cropping up, and yet people who were experts were disputing them. Now, that was in 2005. 2013, the same person was going around to the other news agencies and also programs saying, I've taken my cell phone away, I don't use it anymore, I've taken it away from my children, they don't use it anymore because they saw the light. They saw more and more research that is being done that is casting light on this. And so now I'm on to my PhD candidacy. I've just gathered my research. I've yet to analyze it. And I'm going to change my scope just a little bit. We need to bring this to those people of where I came from, nurses. It's no longer possible, it's no longer adequate, it's no longer appropriate for our nursing educators to stand and talk to our pre-licensure nursing students who are going to be going out into the world and educating our patients and our populations and stand up there rolling their eyes saying, okay, I'm going to talk about alternative things now, and give 2 sentences and then say, okay, but now let's talk about giving pills to people and to having injections. When we're having people becoming ill because of the environment, because of, as Dr. Alale said, the EMF radiation, as well as nutrition, poor nutrition, and other influencing, to take them into our auspices in the hospital, bring them into health, and then take them back into their own environment without truly being holistic, as other countries are, seeing what is going on in the household. Other countries, I'm a dual citizen, I'm German-English, or German-American, and when going home to see my aunts and uncles, I was wondering in the 80s even why they were pulling all the plugs out of the wall before they went to sleep, and asking them, what are you doing? And they said, oh, you can't sleep with all this electrical. And I'm looking at them and going, oh my gosh, I'm not believing this, only to find out that they had been educated by their governments. They had been educated, and they trusted what the university researchers were saying. And now we're finding out that they were true, that they are actually living healthier than we are. Don't get me started on genetically engineering foods, because that's also into it as well. And so my PhD study is going to educate the nurse educators. I'm getting the pulse beat. I'm getting the temperature of what the nurse educators are believing about doing alternative, looking into getting off of Square Center and going out and taking a look at other means that are making people ill and bringing them back to wellness again in a true holistic environmental way. And we need to have these people going into houses, community public health nursing. This would be the bomb, to go out and do these types of assessments along with the regular assessments that they do with home health education. And so this is our driving force for the future. This is what is going to help us maintain wellness and regain wellness in looking holistically around everything. And with that, going into the home, I want to introduce the movie that we were going to be seeing, the video that we're going to be seeing. And if somebody could show me what button to push, I'd be glad to. Thank you. Thank you so much.
Scientists estimate that our daily exposure to EMF radiation is 100 million times higher than it was in our grandparents' time. And with this has come a price no one expected to pay. The question you should ask yourself is your home killing you? Over 1 million articles of medical research can be found linking 9 of the top 10 diseases killing Americans to overexposure to EMF. According to Dr. Joseph Mercola, new scientific evidence is continually emerging that nearly all the 20th century human plagues can be tied to some aspect of our use of electricity, including acute lymphoblastic leukemia in children, brain tumors, malignant melanoma, asthma, cardiovascular disease, immune system dysfunction, hormone disturbance, brittle diabetes, sleep disorders, headaches, Alzheimer's disease, and ADHD. And this is just a partial list. Dr. Magda Havis, PhD from Environmental and Resource Studies of Trent University, also says that over 35% of the U.S. population may be affected by overexposure to EMFs. The most vulnerable to microwave radiation and EMFs are women, children, and at-risk adults with existing conditions. Troubling studies are reporting that children living in homes with elevated electromagnetic fields are at risk of developing leukemia. The rise of autism cases is as much alarming. In 1950, the incidence of autism in children in the United States was 4 in every 10,000 children. In 1975, this number was 5 in every 10,000. By 2009, it had shot up to 120 cases of autism per 10,000 children, with numbers rising every year. There has been a dramatic increase of unexplained diseases and disorders since the 1980s in the U.S. The culprit is EMF, or electromagnetic fields. EMF can be measured in levels of radiation and are emitted by all electrical devices and devices that emit radio waves, even when they are turned off. Remember, you are an electrical being. At the cellular level, your cell membrane receptors recognize electromagnetic fields at very low levels of exposure. In 2011, an agency of the World Health Organization classified radio wave electromagnetic fields as possibly carcinogenic. The Environmental Protection Agency, EPA, is reporting that 6 out of 10 homes are sick due to air and radiation pollution that includes greenhouse gas and EMF emitted from an aging electrical system, the increased number of wireless devices and appliances. This creates an e-smog in and around our homes. Let us listen to the personal story of Dr. Rhoda Alale, who has served on advisory panels for the last 5 presidents of the United States.
I went to Ohio, brought this house. I'm getting it ready for my sons to come home. And from the day I brought that house and the first night I stayed in that house, I started getting sick. So he says, Mom, I'm coming home for my 3-week holiday. I said, okay. I got your room already with this safari African theme in there, so I'm sure you'll enjoy it. And he came in the house and happy-go-lucky kids.
So, we would like to...
Scientists estimate that our daily exposure to EMF...
How do they say? Would you like to learn more? Of course, the answer is yes. So what do? You go to your program, and if you didn't get a program, you can download one from the conference website. And you go to page 51. And on page 51 it says, because I knew she wasn't going to monitor to her time and there wouldn't be time for questions, but that's when I even thought that Butch Pele would come, but he was not able to come. So for those of you who are online doing your evaluations, Dr. Alale took his time. So that's why I put a 60-minute panel, email questions to Rhoda Zione Alale at hotmail.com. It's in the program. It's the only time I've ever put such a thing in a program. But you want to email her and she will send you the link to the video to her website. And you might, this time next year, like me, I'm on my second flat battery in the back of my cell phone. Okay, because if it lasts for about a year, well, when it got to 8 months, I made sure that I was getting some more. My mother sleeps with such a device at the head of her bed, as do I. She's come to my home and personally fit my electrical box with the device that she showed, that black coil. Some people, there was a time when people thought the world was flat. Some of them continued to believe it for a long time. Well, when it comes to EMF, I'm not going to continue to believe the world is flat. So, and I'm not going to allow my parents, even my father, who's a real skeptic, he has his flat battery in his pocket near his cell phone. So we're going to congratulate our panelists, Dr. Alale and her colleague, who is helping to revolutionize nursing. And we're going to proceed, if you can, to our closing dinner celebration as a communal act that recognizes that we've been a wonderful 2-day community. For those of you online, we are delighted that you now have a link that you can share with your colleagues, not only to Dr. Williams's talk that was truly historical yesterday, but to all those that are available, including what we just heard. I was sitting there and I realized, oh my God, I got a call yesterday from my sister that one of her dear friends had a seizure. And I'm like, wait a second. We really have to do what we can to spread the word. Thank you very much. And I'm delighted that I had the opportunity to be a workaholic who worked at a new unknown level of work to bring this to you. So it only exists because you were able to participate and experience it. So that's my gratification. Thank you very much. The end.